Good afternoon. Annette Rodriguez, Health Director for the Corpus Christi Nueces County Public Health District. It will just be myself and Dr. Bird presenting today, and I'm going to start with the COVID-19 Nueces County statistics. So on the very first slide, you're going to see what we've talked about a few times, is that the first identified Omicron case was collected on December 14th here in Nueces County, which was really just a month and a half ago or so not very long ago. The variant accounts for almost 100% of all of our cases currently, not only in the United States, but also Texas and also here in Nueces County. So January the 20th, we had our highest number of positive cases, and that was at 1,581 in one day. So in December, a month and a half ago, I guess, December 2021, we had 65 cases of COVID-19 on average per day. Compared to January of 2022, we had 739 cases on average per day. So big difference, and everybody knew a lot of people were getting sick, and so we all knew that it was due to the Omicron variant. So if you look at this next slide, it shows the waves through time. So in 2020, you saw the wave in July with the original virus, and then you saw the next wave. There was the winter wave that was in January, and that was around 5,500 cases. And then you saw the third wave, which we all knew of, the Delta variant, and that was almost 12,000 cases in 1 month, in the month of August. And then the most recent fourth wave was the Omicron variant, and we had last month over 23,000 COVID cases just in Nueces County alone. The good news is that the number of cases is coming down. So as you can see here, for February, we've had 2,344 cases, but we also know that we're early in the month of February, but the cases are coming down. So let's look a little closer at that. On the next slide, you're going to see the weekly cases, because this really gives us a better picture of what we're looking at. So November through December, it looks kind of flat now, 300 cases, for the weeks. But then what happened was right after Christmas time, December 27th, we jumped up to 1,373 cases in that 1 week. And then the following week, the first week in January of 2022, we jumped up to 5,500 plus cases. And then January the 10th was the highest week of cases, and we had 6,929 cases in 1 week. And now we're starting to see that trend of these cases coming down. So again, this is really good news. This was a very highly transmissible variant, as we can all remember very well. On the next slide, it actually shows the number of deaths that kind of go with the different waves. So on the first wave, we had up to 180 deaths. This was before the vaccine actually came out. And then in January, our second little wave, which was around the winter months, we had 108 deaths in that 1 month alone. And then in our third wave, we had up to 180 deaths in the month of September, because we know that the deaths lag from the cases. And then just recently, these last 2 months, in January, we had 60 deaths due to Omicron, and in February so far, we've had 35 deaths. And we circle that to show that it's been much less deaths, even though we've seen more cases, which tells us that the vaccine is working. It's doing what it needs to be doing. So that's good news. On the next slide, it actually is an age breakdown of cases just for this year, for 2022. And what's really important to us here, something that we really hadn't seen over the course of the pandemic, was that young age group, 19 years of age and younger. 7,102 of that age group have had COVID-19 in the last month and a couple of weeks. And so again, very concerning for us, because we know that as more and more children get COVID-19, you're going to see additional hospitalizations in the pediatric population. The next slide shows the hospitalizations and the ICU. And you see that upward trend. You can see that from January till about the end of January 25th, 26th, 27th. You can see that upward trend. And then it kind of looks like the number of hospitalizations with COVID-19 kind of plateaus. And now we're starting to see the number gradually decrease. If you look at the ICU, you see a much slower progression, up to around 45, 50 cases in the ICU with COVID-19, and we're at about 40 in the ICU today. So for our drive-through testing, we were at one time, back before the Christmas holidays, we were seeing about 18, 20 people in our drive-through. And then once Omicron came to our doorstep, we started seeing thousands of people coming through our drive-through in one day. And so the number coming through our drive-through has dropped. If you can see on the top where it says January 31st, 2022, 284 people tested through our drive-through. And below that, you can see 179 people tested, 160 people tested, 118 and 181 just recently. But the other really important part is the positivity rate. So if you look at the positivity rate, you see at the top 50.7, the positivity rate, that's for the people that are coming through the drive-through. And so what you're seeing is it's dropped down to about 42% just a few days ago. So the positivity rate is coming down, not as fast as we would like it to come down, but it is coming down. If you look at the bottom box, that basically shows you in July of 2020 when we had our first summer wave, we were testing 2,346 in that month through the drive-through. In August of 2021, we tested 6,683 people through our drive-through. And last month, we tested 14,163 people went through our drive-through to get swabbed. So big differences in these numbers. The pediatric symptoms, the main symptoms for children, and this is really important for parents because there's children that are still too young to be able to talk. And so you kind of just have to know they're sick. You can tell they're sleeping a lot. But the prominent symptom for children is the cough and the fever. But there are other symptoms of COVID-19. And so it's sometimes that they're vomiting, so they can't keep down their bottle. Sometimes they have a lot of diarrhea. Muscle aches, extreme fatigue, again, they're just kind of listless, sleeping a lot, severe headaches, and so just you can't always tell when they have a headache, but they're just constantly screaming because something's bothering them. Persistent pain or chest pain, a 3-year-old can tell you, a 4-year-old can tell you that it hurts. And so dehydration, trouble breathing. If you see any of these signs or symptoms in your child, please take them to the emergency room or make sure that you contact their pediatrician. Vaccine breakthrough cases in Nueces County. So we've had a total of 13,785 breakthrough cases. 8,756 were collected since January 1st, 2022. So just last month, 8,756. A lot of people say, well, it sounds like the vaccine isn't working. You have all these vaccine breakthrough cases. That's not true. The vaccine breakthrough cases were to be expected. Remember, nothing was at 100%. Even with your booster, you were only up to 80% protected. So if you did pick up Omicron, you could get COVID-19. You just would not end up, hopefully, hospitalized, or you wouldn't end up dying from COVID-19. We did have some hospitalized, 393, and we had some deaths, 124, and again, those were to be expected because you have all types of vulnerable populations, and so when so many people are infected with the virus, you're going to see that happen. The reinfections, we really haven't talked about a reinfection. So this is when you've gotten COVID-19, maybe right at the beginning of 2020, when we were still trying to learn about this novel variant. And so you got COVID-19, and now what we see is people are getting COVID-19 again. So that's a reinfection. So you can see it looks like in August of 2021, there's some reinfections there. but a lot more reinfections with the Omicron. The other thing that's really interesting is that if people had the Delta variant, Omicron variant was so smart that it actually knew which people had Delta and it reinfected them. And so that's another interesting reason why you see those peaks for the reinfections with the Omicron variant. On this slide, it basically just shows how many vaccines the health district has administered. So to date, we've administered over 206,166 doses of COVID-19 vaccines. For all of Nueces County, with all of our other providers, hospitals, everybody that's doing their part, we've given out 504,455 doses of COVID-19. The total boosters that we've given at the health district has been 30,296, and the total boosters given in all of Nueces County by all of the physicians, pediatricians, is 80,370. And that's really an important number there, that 80,370, and that's because if you only had their primary series, your 2 mRNAs or your 1 J&J, you only have about 25-30% protection against Omicron. But if you were to get your booster, you're going to have 80% protection. So the boosters are really important. So what we're trying to do right now at the health department is send out reminders, because sometimes people forget, has it already been 5 months? Yes, it has. It's time to come in and get your booster. So the vaccination rates, people continue to ask us, so are the vaccination rates increasing? And yes, they are. The good news is, for all of Nueces County, the vaccination rate for those fully vaccinated, which means that they have at least the 2 primary mRNAs or the 1 J&J, it's 56%. So we are moving that needle very slowly, but we're moving it. And if you look at the other age categories for those 5 years of age and older, 60%, for those 12 years and older, 65%, and for those 65 years and older, the most vulnerable populations, we're at 81% of our community is fully vaccinated. So that's really, really great news. Our COVID-19 vaccine clinics, we continue to have consistent clinics so people can find us so that you can get vaccinated. We're still at La Palmera Mall, at the former Charming Charlie's. We're at the Greenwood Senior Center, which is close to the health department, and that clinic actually opens early. It opens at 8 in the morning because we know we have some more elderly people that like to get up in the morning and get their vaccine and get done with that. We're also out in Robstown at the outlet malls, at the old Nike store. We're at the Hilltop Community Center in Annabelle. We're at the Nueces County Courthouse as well as here at City Hall. And we're also, starting tomorrow, we will be in Port Aransas at the Marina Pavilion. And we're going to be there every Thursday from 12 until 6 until the first week in March. The next slide basically shows our vaccine clinics that are outdoor clinics. Some people don't want to go indoors to get a vaccine because they don't want to get any type of exposure. And so we have the QSR Legacy on Staples. We also have the FIAS parking lot on SPID. And we have the Goodwill Store that we continue to be at every week consistently. And we're still at the different schools. We're at the different elementaries, and these are some of the elementaries that we will be at next week. We're also going to start reaching out to our daycare population because we are anticipating that the FDA will approve the vaccines for those little bitty ones, 6 months to 4 years by the end of the month. And so we want to start having clinics at the daycares as well to get those children vaccinated as well. And finally, our testing sites, we continue to be at the old Christi Memorial Hospital on Hospital Boulevard, and we're there only twice a week now because we've seen that the demand has gone down for testing. Now people get their test at home, and so the demand really has started to diminish, which is really a good thing for us. And so 9 to 5 on Mondays and Thursdays, we are at the old Memorial Hospital, and we're testing, we're swabbing to make sure that you're COVID-free. We're also Amistad at both Robstown and on the South Brownlee Boulevard is also still testing, but you do have to make an appointment. And so you can visit amistadchc.com to make an appointment. So where can you get the test? So if you're wanting to get home test, you can visit www.covidtests.gov or www.special.usps.com. And you can order up to 4 tests per household. And if you want masks, because you're running out of masks, some of the participating pharmacies such as H-E-B, Walmart, Sam's Club, Walgreens, and CVS, as they have them available, they're giving them out to families as well. If you have a home test and you test positive, you can actually go on our website at cctexas.com, and you can click on Submit at Home COVID-19 Test Results, and you can put those test results in so that way we can count you as either being negative or positive. I will now let them translate, and then we will go to Dr. Bird. Thank you.
Omicron continúa siendo una variante de preocupación. Esta fue encontrada en el condado de Nueces el pasado 14 de diciembre y representa el 99.99% de los casos nuevos en los Estados Unidos. En lo que va del mes de febrero son 2.344 casos nuevos por coronavirus. Los casos han estado disminuyendo. La semana con el mayor número de casos positivos fue del 10 al 16 de enero de este año. El número de fallecimientos en el condado de Nueces asciende a los 1.407. El grupo de personas que cuenta con mayor número de casos positivos se encuentra en el rango de edades de los 0 a los 19 años, más de 7,000 casos de estos en el último mes. Los niños con COVID-19 pueden tener muchos síntomas, solo unos pocos síntomas o ningún síntoma. Los síntomas más comunes de COVID-19 en los niños son tos y fiebre. Los posibles signos y síntomas incluyen dificultad para respirar, deshidratación, dolor persistente o presión en el pecho, nueva pérdida del gusto o del olfato, cambios en la piel como áreas descoloridas en los pies y las manos, dolor de garganta, náuseas, vómitos, escalofríos, dolores musculares, fatiga, dolores de cabeza y congestión nasal. El total de vacunas administradas por el Distrito de Salud Pública es de más de 206,000 hasta el día de ayer. Se estima que el 55.6% de la población elegible a la vacuna se ha vacunado, mientras que las vacunas combinadas por otras agencias, así como el Distrito de Salud, son más de 500,000 de vacunas. Las clínicas de vacunación continúan abiertas, así como en algunas escuelas primarias del CCISD. Para encontrar esta lista completa, puede acudir a la dirección www.cctexas.com/clinics. Las pruebas para la detección del virus continúan ofreciéndose en el antiguo Hospital Memorial, ubicado en el 2626 de Hospital Boulevard, los días lunes y jueves de 9 de la mañana a 5 de la tarde, así como en la Clínica Amistad, aunque este último solo con cita previa. Le recordamos que cada hogar en los Estados Unidos es elegible a recibir 4 pruebas caseras gratuitas para la detección de COVID. Para obtenerlas, tienen que llenar una solicitud en línea a la dirección www.covidtest.gov o www.special.usps.com. Si obtiene un resultado positivo, se le pide reportarlo al Distrito de Salud Pública visitando www.cctexas.com y haga clic en Submit at Home COVID-19 Test Results. También existen cubrebocas gratuitos disponibles en algunas farmacias participantes, como H-E-B, Walmart, Sam's Club, Walgreens y CVS.
All right, good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team, and this is the weekly pandemic report. We have 2 objectives. One is to address your questions and concerns about COVID, and the second is to enable evidence-based decision-making on behalf of our local leaders. Okay, we'll get right into the new case data. So in the black data points, you see the number of new cases per day that are confirmed in the coastal bend, so not just Nueces County, like what is reported by the public health director. And what you can see is that they're coming down very quickly. There's 2 projections. These are the same projections that I've been making since the end of December. I haven't changed them in any way, shape, or form. And what you'll see is that our peak fell between the 2 projections, but was more on the side of what happens when we avoid COVID, mask, do things to stop the transmission. So that's good. And then the cases are dropping off faster than predicted, so we're very happy about that. I'll say in the past, I would adjust the model to fit the data as we got more information, but there's pretty much nothing I can do this time to balance out the hospitalizations versus the cases, and that's something that's inherent inside the model software that I'm using that cannot be controlled with just hospitalization rates and things like that. So in the end, we got the peak about right. Luckily, their cases are going down more quickly, and we expect them to continue to decrease. But remember, we're still in the hundreds of cases per day on average, and we want to get down to single digits, hopefully down to 0. Okay, in terms of inpatients, again, the projections are what would happen if we did nothing in red, and what would happen if we did things to slow down the transmission of COVID like we have in the past. And you can see that the hospitalizations went a little bit higher than the hopeful projection of avoiding and masking. And it lasted a little bit longer than we thought, but it's definitely coming down now. You can see those black data points coming downwards, and we expect it to continue to come down in the coming days and weeks. So decreasing. Okay, for the ICU, we have about the same pattern, but in this case, the peak was right around where we predicted, and now the cases are dropping fairly rapidly. So since last week, we've had maybe about a 40% decline in the number of people with COVID in the ICU, and that's a very good sign. If you remember from last week, there was a 61% increase over the previous week, so we're definitely moving in the right direction when it comes to that. We hope these ICUs continue to drop off the way that they are right now. And that's rapidly decreasing. Moving forward, this is a graphic that represents how many people are in the ICU, just like the last graphic, but it shows a little bit more of the pandemic, starting with all the way at the left, the peak in the summer of 2020, and then going up to present, and I've labeled the alpha wave, the delta wave, and the Omicron wave. And so what you can see is that during Omicron, we peaked out with more COVID patients in the hospital than during the alpha wave, but it's much narrower. So overall, over the course of the Omicron wave, we're ending up with less people in the hospital over time, but there was still quite a bit of pressure last week when the ICUs peaked. So it's something to realize that even with a variant like Omicron that's less virulent, sending less people to the hospital, that we can still have issues and pressures on our healthcare system. And that's one of the reasons why we're so focused on COVID still, almost 2 years after we realized this pandemic had started. Okay, and the key thing here is that vacancy number. Now, the vacancy has just about doubled since last week, so that's moving in the right direction. We want more room in our ICUs so that if people need care, they can get it. And what you need to understand is that 5.9% doesn't mean that there's plenty of room and that everything's working as it should. What it means is that there's a lot of stress on the healthcare workers right now to maintain the ICU. And the hospitals try to maintain a cushion, and at least now we're in a place where we didn't have to go all the way to 0 like we have in previous waves. So it's important to realize that the vacancy is low, and we really want to keep doing things to help Omicron recede, rather than if we stop taking off our masks now, or if we stop trying to reduce the transmission of COVID, if we take off our masks now, it'll prolong the Omicron wave, because that will increase transmission and more people will get sick, more people will go to the ICU. So we want to hold out for a little bit longer here. Moving on to fatalities, I held off until last week in showing this projection, but it looks like the fatalities are on their way up. I know that when you look at that figure, it's coming down, but it's part of the nature of the way the fatalities are counted. And you get numbers every day from the public health director, but this graph goes from the public health director's office to the state, and then they do some counts, and then it takes 2 weeks, 3 weeks for those data points to come back. And so because of that, what we've seen in the past is it takes a while, and the curve keeps growing in the past for fatalities. So we expect that it will have more fatalities pushing in, and unfortunately, I don't foresee it just coming straight back down to zero, but let's hope that that's what happens. Okay, so in summary, cases are going down quickly. Hospitalizations are declining. ICU people with COVID are going down quickly. So things are moving in the right direction here. Remember that one thing we can do with these projections and simulations is show you what would happen if we do one thing versus another. And it's very clear in the model that if we do things to reduce the transmission of Omicron, that it reduces the peak number of people that are in the ICU, that are in the hospitals, so that people that need heart surgery, people that get into car accidents and need care, they can get that. So going back to normal now is not what we want to do yet. We want to hold out. There's still hundreds of cases per day. And if we go back to normal, it will boost the transmission rate and it will result in more cases, more hospitalizations. So the ICU vacancy is still low, even though it's double of what it was last week and it's moving in the right direction. We want to remember that the system is still, close to its capacity. And we want to give these healthcare workers a break. They've been doing this for 2 years. The only way that they can get away from it is to quit. And that's part of the reason why we're near capacity again, because there's just less staffed beds in our hospitals now than there were a year ago. So to combat Omicron, it's simple. Try to avoid getting exposed to COVID. If you're inside, put on a mask. That will reduce the chances that you inhale the virus or have it, touch your eye or anything like that. It gives you substantial protection. Well, masking helps with inhaling. Glasses help with COVID being introduced to your body through your eye. And you just want to try to avoid those situations. Vaccination. I know that, everybody's trying to spin the vaccination results in various directions, but here's what we've been telling you for months now, which is that vaccinations are going to make whatever symptoms you would have had from COVID not as bad. All right, so it seems like a pretty good proposition to me, where some people die, some people go to the hospital, some people just have a bad day. It won't be as bad if you get vaccinated, you get up to date on those vaccinations, and a lot of people won't get COVID, but some people will. It's possible to get COVID if you're vaccinated. But the thing is that it won't be as bad as it would have without the vaccination. So that's the key. And lastly, if you do start to feel sick, isolate, get tested. This will help you to stop the spread. So, because here's what happens. Maybe you're not really worried about the negative effects of COVID, but there are people in our community that can suffer extreme negative effects from COVID. And if you are transmitting COVID onto other people, then you're that link in the chain. You're continuing that process. You're allowing the wave to continue, and COVID could then spread to somebody that will not fare as well as you do. So that's our report for this week. We're going to do something a little bit different, where first we're going to take any questions, and then we'll go to a translation. So are there any questions? No? Okay, we're good. Questions? We're going to go to the translation. Thanks, everybody.
Se estima que continuando con la utilización de cubrebocas, los casos por la variante Omicron pudieran ser casi nulos para el mes de marzo. Actualmente los casos positivos y las hospitalizaciones están disminuyendo de manera considerable. Los casos en las unidades de cuidados intensivos por Omicron han sido más altos en comparación al invierno del 2021. Aún así, las vacantes en esas unidades en los hospitales del área es de solo el 5.9%. El número de decesos también ha disminuido y ha sido mucho menor en comparación a los casos por la variante Delta. En resumen, los casos y las hospitalizaciones están declinando. Esos casos continuarán disminuyendo siempre y cuando continúe la utilización de cubrebocas, así como buenas prácticas de salubridad. Las vacantes en unidades de cuidados intensivos aún es baja, pero el incrementando, mientras que los trabajadores de salud están siendo afectados debido a al cargo del trabajo. Para continuar combatiendo Omicron, se recomienda evitar lugares aglomeradores, continuar el uso del cubrebocas, obteniendo las vacunas así como los refuerzos y realizando la prueba de detección en caso de tener síntomas. Si resulta positivo, aíslese y consulte a su médico para seguir un buen tratamiento y evitar contagiar a más personas.